So we are trying to understand the reason behind this research in the first place. What prompted this?
Yes, so this is part of the Afrobarometer survey that is carried out every 2 years. And in the course of this round nine, we found it necessary to also ask Ghanaians specific questions in relation to how government managed the COVID-19 pandemic and other issues that come out from the management of COVID-19. So these are just a few questions that we wanted to seek the opinion of Ghanaians about so far as COVID-19 and its management are concerned.
All right, so you speak of Ghanaians. A sense of the number of Ghanaians Amoni Omudi Nkomo in terms of these questions, specific questions you wanted responses for.
Yes, it's. I think we've been consistent with our survey and our sample size, having roughly 2,400 adult Ghanaians, that is anyone from 18 years and above, qualified to be selected to be part of this Afrobarometer survey.
Okay, so originally, Obetimi spread now. Was it across the 16 regions?
Okay, so I am not able to give you the specific number, but what I can say is that in our sample, we make it proportional. So for the 2,400, what we do is we make sure that every region's population strength, so the proportion of the regional population in relation to the national population is reflected in our sample. So here we have our sample size of 2,400 respondents. What we do is we consider the national adult population and also the adult population for each region, so that if the adult population or the proportion of adult population for Ashanti region is 10%, then in our sample, 10% of the respondents will come from Ashanti region. And we do same for all the other regions, so that we will have a very proportional representation also in our sample.
I was thinking, saying, considering the dynamics of the sample I'm using, you would have considered the most affected areas during the COVID-19 period, Greater Kumasi, Greater Accra, and some regions that were badly hit. So that in terms of your sample size, the appropriation would have been different. Did you consider that?
I think that's a very brilliant suggestion, and it's something that sometimes we do when you want to understand a specific issue, how people react to certain issues based on where they are. We oversample, we call it oversampling. But this didn't require, COVID-19 was everywhere so far as we are concerned, and we had to allow everyone, every adult Ghanaian who qualified to participate in our survey to express their opinion based on where they are and what they saw in relation to COVID-19. So if you look at the questions that we asked, I think, it is fair to give everyone the chance, to also express their opinion. Here we were asking people the assessment about how government performed in managing COVID-19, and also specifically in terms of how government's efforts ensure that health facilities were adequately resourced, education of children would not be interrupted, and generally how government managed the relief packages. And I think it was done throughout the nation. So it is right and fair to allow all our respondents to respond to these questions. And again, these set of questions were part of a whole lot of issues that we asked Ghanaians about. So yes, introducing these different dynamics sometimes makes it complicated. But if you look at the issues that we asked, I think everyone or every Ghanaian, was capable of responding to these issues.
I don't disagree with you on the capability of Ghanaians to respond to these issues, but if you're asking questions as to the effects of COVID-19 on them and you're taking data from them, I would expect that, again, people who are badly hit would be the ones who would be well positioned to say they will speak to issues as to how COVID-19 affected them. You talk about those whose jobs were also affected. It is the endemic areas who can properly speak to these issues. For instance, if Greater Accra, there were, let's say, 1,000 people who were affected by COVID-19, and let's say Volta region, there were just about maybe 100 people who are affected by COVID-19. It would make sense that Greater Accra would have a larger sample size to be able to tell the story of how the job losses and then the income differentials impacted on them.
Well, I think I differ in that respect. You know, it is one thing being directly affected by COVID-19 in terms of health implications and the other consequences. And as all of us came to understood, the socio-economic consequences of COVID-19 appear to be even more than the health consequences that we suffered as a nation.
True.
And it is also not always the case that places where COVID-19 occurred most, or where they recorded most incidents, were the places that the socioeconomic effects were the harshest. If you had traveled to Volta region, you would have realized, or even throughout the COVID-19, there were a lot of sentiments in some of these border towns. You go to Aplao, and if you know the economy around, that side, all the way the border area, you realize that a lot of people could not even undertake economic activities because the borders were closed. So there are so many complications around the socioeconomic effect of COVID-19. What you and I might think is the harshest impact would differ depending on where another person is. Probably not the harshest, but depending on their own conditions, something that you wouldn't put much weight on probably will be or will have a devastating effect on them. So I think it was still proper to allow people wherever they are to estimate or express their opinion so far as these COVID-19 measures are concerned.
What is this report or survey to achieve?
Well, the survey one allows us to understand from the citizen's perspective how well government manage staff. Also allow us retrospectively to understand the impact of the measures that the government put in place. So asking questions about the fairness or unfairness of the distribution of COVID-19 relief items, where majority of Ghanaians indicated that they think the measures that the government put in place to distribute these relief items or relief assistance were not fair. Then as a nation, I think we have the cause to sit back and examine, what government did right or did not do right. Also bearing in mind that COVID-19 had impact on a lot of people. So if a lot of people were directly impacted by COVID-19 and the measures that government put in place, people think were not fair, it means we may have left out a certain portion of our population in terms of trying to overcome the harsh consequences of COVID-19. So this takes all of us, into the realm of making some retrospective reflections on all the measures that the government put in place and whether there is a need as a country to re-examine some of the path that we took so far as resolving COVID-19 crisis, is concerned.
Go for it. I thank you for your time this morning.
Most welcome and thank you.